Some pediatricians say that they are overwhelmed by a wave of concerns about young patients' mental health. Some help could come in the form of a team of child psychologists and psychiatrists that would work with local doctors to diagnose and treat children. KXAN's Tom Miller reports on how the unease caused by the pandemic is filling children with worry.
As children around the country stay home from school because of COVID-19, some unwelcome guests are joining them in isolation, anxiety, and depression.
Just realize, as a result, oftentimes of the social isolation and some of the fear related to how COVID-19 can affect their friends, family.
Dr. Roshni Cooley is a child psychiatrist at Dell Medical School, a leader in treating mental health issues in young Texans.
Does it have a different impact on a teenager compared to a toddler?
So if we think about a toddler or a young child, even up to the age of 5, the way that they express their emotions is much more from a behavioral standpoint. So they may have more tantrums or acting out a little bit more or not sleeping very well. For a teenager, you may see more pronounced irritability, more anxiety. They oftentimes can be more verbal if they choose to be.
The new Child Psychiatry Access Network is a team of more than 25 child psychologists and psychiatrists based at Dell Medical School at the University of Texas, helping pediatricians across the state.
If they're sort of at a point where they're not sure exactly what maybe to do next, they have this ability to call this phone number and we'd be able to talk about the case, talk about what's happening.
However, to avoid that level of need, Dr. Cooley says stay physically distanced but socially connected.
We still want to be socially connected. That's essential for all of us as humans. So how can we remain socially connected? And that could be by phone or FaceTime or virtual Zoom meetings.
In Austin, Tom Miller, KXAN News.
Last year, the state legislature approved $100 million to create the Child Psychiatry Access Network. It launches a week from today. Meanwhile, a new study from Texas Children's Hospital and the Baylor College of Medicine documents the outcomes of children who have had COVID-19. Of the 48 American and Canadian children who they studied, more than half were boys. Also, almost 3/4 of the children had respiratory problems, and 2 of the children died. Their ages were 12 and 17, and both had pre-existing conditions.